Next to speak is Dr. Brenda Reyes, who we all know and love, from the city of Houston, Texas. She's the Bureau Chief, Community and Children's Environmental Health, Houston Department of Health and Human Services, but also the co-chair of the National Safe and Healthy Housing Coalition Policy Workgroup.
Good morning, everybody. I hope you finished with your breakfast already, and we are a little awake after such an interesting presentation that we had before. And what we would like to see is what we are hearing here, what we're trying to present, and what we're trying. The object of this is to get you guys engaged, and probably to clarify. One of them, what she was asking me at early stages was, why was I becoming a member, a co-chair? I cannot lobby because I receive the federal fundings. I always make this clarification very, very strong. I do not lobby. I provide education. Each one and every one of you guys here, you guys, we have the data. We have the information. Since she doesn't have that information, she's the one that is doing the lobbying. We educate. We understand our states, our cities. For me, it was extremely important to let my voice be heard because I am talking about my community. That's exactly what each of us do. You are the only person that can talk for your community. Whenever the media or somebody needs a family, whenever there is a concern in your community, you can be a voice, you can be a strong advocate, providing the education. And going to the coalition of the National Center for Healthy Housing, the policy, we are able to move our voices to a different level, to a different layer. And this is extremely important for us, where it is not just Brenda talking to Houston, to the authorities on Houston, but it will be now the health department, okay, or the community of Houston talking to the steering committee, to the coalition, I'm sorry. And then the coalition, whenever they do the lobbying, they can actually put the examples. If we go with them whenever they have their lobby day, I have gone already 3 times. And what I do is I bring my education points. I don't discuss budget. I don't discuss, you have to, I would love to be able to do that, but I can't. So, but we have the passion, we have the knowledge. The moment that we start talking about this, the information just flows. I mean, we were talking yesterday and these previous days, and each of us has so many stories and so many experiences that they just come out of our ears. And, they are almost the same. So this is why it's so important to belong to the coalition, because one person cannot make a difference. We need each other to make our voices strong, to make our voices being heard. And I would like to mention something just to follow up on this one. Point number 1, I just love her hands. Point number 1, point number 2. I know, I'm going like this.
You gotta be careful with point number 3.
One of the items is the calendar in point number 1 that we have. That way, whenever you're going, whenever we are in our environment, we'll know when our officials are on vacation. We can actually invite them to come over. Do you guys think about this? Whenever you receive the grant, you have to get the approval, the request for council action, the RCAs. I don't know if the words, the acronyms could be different, but in our case, the city council has to approve the health department to use these federal fundings. So we have to go to city council. I love it whenever they table it, because it gives me an opportunity to go there and give the education, discuss with them, and go to their office. And in their office, then you can sell your program and, one-on-one, bring them on, capture them and capture their attention, closer. We have the data. We can tell them in the districts or in the parish or wherever is the distribution, the zip codes where they control, where their area is, the political area. Just go right there and you have a picture of what is the condition of that area. So this type of situation is not lobbying. This is providing the education on one-on-one. And it's extremely helpful for us. That information now, through the coalition, we can bring it at a federal level, not just at our local levels.
You got 2 more minutes.
Okay, I can do 3, 4, 5, not a problem.
No, we can get it down.
Okay, so I talked to you guys about become members of the coalition. I really would like to encourage you guys to do that. We need the help, and you know, the coalition is not, you're not going to be writing reports or creating or having to attend to all these long meetings or anything. Most of the time is, what can we do? Usually at that meeting, you know, like from last night meeting, we got some ideas. We will put it in place, we will try to develop something about it, send it back. You say, hey, this is great, or present it in the next meeting we have, like we're doing with this. And it's very simple, it's not a job for you guys, it's to develop the tools for what you guys suggested so we can implement it. That's one of the things that I like, because I'm waiting, you are working in some templates, whenever we go and, you know, if we want to write to the editor, I'm going to the next one now. You know, they are letters, they are templates of letters, of brochures and information that we can get through the coalition, so we don't have to create what already has been invented. What else do you want me to do?
That's all right.
That's what you're...
Thank you, Brenda.